Hello, everybody. Today we are going to talk about diabetes in Aboriginal and Torres Strait Islanders. Before we begin, we wanted to acknowledge that we are on a traditional paragamatal clan land, and it will always be so. Also, we pay our respect to elders in past and present. First of all, I would like to introduce my group members, myself, Biresh, Baishali, Riyadh, Barsha, and Ashin. Today in this video, I, Biresh, have given my voices in which our group will elaborate and cover the issues of diabetes mellitus amongst Aboriginal and Torres Strait Islanders people. Before we give you any information, let us familiarize with the topic included in the presentation video. Foremost, we are going to discuss how the culture plays roles in Aboriginal and Torres Strait Islanders' health. Next, we'll talk about diabetes mellitus and its consequences among the Aboriginal and Torres Strait Islanders, followed by associated social determinant of health. Furthermore, we will examine the importance of health promotion as a healthcare need. Lastly, we will address culturally competent and safe nursing practice in relation to diabetes in remote areas. It is well-known fact that traditional owner of Australia are the Aboriginal and Torres Strait Islanders. They have coexisted with this land for over 60,000 years. During this time, they were healthier as opposed to today. The traditional food culture at the time was hunt and gather. The unfair law and communicable diseases brought by First Fleet resulted in Aboriginal and Torres Strait Islanders being driven away from traditional land. The introduction to easily contracted diseases such as smallpox, ill practice of alcohol and drugs related in lower health status among Aboriginal and Torres Strait Islander community. As a result, their spiritual connection with their land were broken, which led them to live an inactive life. The inactive lifestyle caused them to develop a chronic disease such as diabetes and heart disease and many more. First of all, what is diabetes mellitus? Let us explain to you what is diabetes mellitus and how much it affects Aboriginal and Torres Strait Islanders' health. Diabetes is an epidemic of the 21st century, and it is one of the biggest challenges confronting Australia's healthcare system. Approximately 1.7 million Australians have diabetes, with 280 Australians being diagnosed with it every day. To put things into perspective, in every 5 minutes, someone is being diagnosed with diabetes. Diabetes is a chronic disorder in which a person has a high blood sugar level, either because the body doesn't produce enough insulin or because the cell do not respond adequately to insulin produced. There are two main types of diabetes, namely type 1 diabetes and type 2 diabetes. Type 1 diabetes is characterized by autoimmune destruction of insulin-producing cell in pancreas, means when pancreas doesn't produce insulin. So what is type 2 diabetes? Type 2 diabetes is the most common form and is characterized by reduced production of insulin and an inability of a body tissue to respond fully to insulin. Specifically, Aboriginal and Torres Strait Islanders are 3 times more likely to have type 2 diabetes compared to non-Indigenous Australia. There are many associated factors to develop diabetes, such as obesity, family history, less physical activities, stress, and habitat of alcohol and smoking. According to Australian Indigenous Health Welfare 2007, diabetes is linked with socioeconomic status. For example, the greater the environmental, social, and economic disadvantage experienced by Aboriginal and Torres Strait Islanders people, the higher the level of type 2 diabetes. As a result, it will increase the risk for associated problem and chronic conditions in the population. If the chronic condition is left untreated, it will increase the risk of other serious conditions like heart disease, diabetic foot, stroke, renal failure developing in future. To justify the seriousness of diabetes among Australian Aboriginal and Torres Strait Islanders, let us show you statistics. This graph is from survey conducted by Australian Bureau of Statistics in 2013, where it was found that 10% of Aboriginal and Torres Strait Islanders in remote areas are living with diabetes. It is essential to remember, due to lack of awareness about the diabetes mellitus, there could be even more Aboriginal Australians affected by this. According to Australian Institute of Health and Welfare 2014, Aboriginal and Torres Strait Islanders, males and females, were more likely to be hospitalized for each type of diabetes than their non-Indigenous counterpart. According to above table, the disparity was greatest for Aboriginal and Torres Strait Islanders female with the principal diagnosis of type 2 diabetes, who were 8.1 times more likely to be hospitalized than non-Indigenous females. It is well-known fact that economic and social conditions such as money, power, resources determines one's health status. The social determinant of a health causes which are responsible for health inequities. There are three social determinant of health related among Aboriginal and Torres Islanders in context to diabetes, which we will be focusing on. These are education and literacy, health practices and coping skill, access to healthcare services. Few following slides will show up which extent social determinant of health impact Aboriginal and Torres Strait Islanders. Education is one of the most important social determinant of health, affecting the health among Aboriginal community. In 2015, Australian Curriculum Assessment and Reporting Authority found that there was a gap of 24.1% between non-Indigenous and Aboriginal and Torres Strait Islanders students attending schools in very remote areas. This large differences highlights the continuous need to encourage and empower the youth and their community to receive basic education, where they are able to implement their knowledge in their daily lives. It is vital to educate the youth about the dangers of unhealthy food, alcohols, and drugs, as well as long-term impact it has on an individual body. Secondly, we would like to focus on the health practice and coping skills among Aboriginal and Torres Islanders by providing information about the nutritious and correct food group that should be consumed. There is need to train the youth and their communities to make right decisions and breaking the cycles. An initiative is started by an eponym Cave York Health Councils called Good Food for Good Sugar, illustrate a healthy diet suitable for individuals suffering with the diabetes. The focus here is on eating regularly and not skipping meals, spreading out sugar throughout the day, eating more whole grain and high fiber food, and choosing products with the reduced fat instead of deep fried food. Furthermore, the poster also lays out healthy alternative in every meal throughout the day. This ensures the person struggling with the diabetes is not stuck with the mundane meal every day. By providing these healthy alternatives, the diabetic patient will be more willing to follow their diet and not return to unhealthy and fatty food. This initiative is an excellent example of an easy to follow meal guidelines which act as a coping tool for new diabetic patients. Now we will be discussing about the third and last chosen social determinant of health, that is access to health services. According to surveys conducted by National Aboriginals and Torres Strait Islander Health Survey in 2005, it was found that 1 in 7 Aboriginal Australians in remote areas are needed to see the doctor in past 12 months, but didn't go. Aboriginal and Torres Strait Islanders female were more likely than Aboriginal men to report that they had needed to go to doctor or dentist but hadn't gone. Factors such as distance, cost, long waiting time, and transport were reported as the main reasons which deterred them from going to see the doctor. Therefore, there are numerous Aboriginal and Torres Strait Islanders that are living with the diabetes but not aware of it, as they are hesitant to travel to their nearest healthcare center. Aboriginal and Torres Strait Islanders have been reluctant to seek healthcare services due to Western dominant model of care used by healthcare professions, which is also mentioned in Australian Bureau of Statistics 2008. Additionally, a lack of understanding towards their culture also been one of the reasons that has influenced Aboriginal and Torres Strait Islanders from going to health care services centers. In order to tackle this issue, it is essential to create culture awareness in all remote health service centers. Hence, it makes evident the importance of health promotion as well as to improve health, which we will discuss in our next slides. As we have seen that previous slides emphasize the role of health promotion in Aboriginal health. What is meant by health promotion and how it can be done? How can it be done? According to World Health Organization, WHO describes health promotion as the process of enabling people to increase control over the determinant of health, thereby improving their health. Health promotion works on a 3 guidelines principle. They are advocate, enable, and mediate. Health promotion by and with the Aboriginal and Torres Strait Islanders plays significant roles in closing the wide gap in health status that this community has compared to other Australians. The higher the distress of diabetes in Aboriginal and Torres Strait Islanders people can be minimized with the help of health promotion strategies. These strategies must be considered as there is a much higher scope to prevent illness among young population. The operations of Aboriginal Community Controlled Health Services, ACCHS, established in Redfern, was the first initiative in relation to Torres Strait Islanders health promotion strategies. Now let us introduce you with some of the projects established by government. The other organizations to upgrade health outcomes around the diabetes in Aboriginal community. It includes Guri diabetes complications and assessment clinic, which is directed in 2004. During the clinical session, local Aboriginal and Torres Strait Islanders community members were provided with a multidisciplinary team within a clinically settings, which is also mentioned in Services for Australian Rural and Remote Allied Health, that is SARA, which is in 2016. Secondly, looking at the Better Living Diabetes Project, which was implemented by Gundir Aboriginals and Torres Strait Islanders Corporation of Health Services in 2001, receives positive response from the community. The reason it was beneficial because it was arranged with the community consultation. While looking forward to Laramba Diabetes Project, Wurli Wurliljang Diabetes Day Program are the few other health promotions programs implemented for the Aboriginal and Torres Strait Islanders people. Although both the government and non-government organizations produce and reproduce various health promotion tools, but also most of them are implemented without carefully assessing its effectiveness. In addition to this, the main drawback to deliver community-based diabetic education in relation to lack of Aboriginal resources as well. To upgrade the Aboriginal and Torres Strait Islanders' health, there are few techniques that can be used as a health promotion tool. The health promotion strategies which we are going to focus on includes two components. First, to increase awareness among community, and secondly, to strengthen the health resources with cultural competency. As discussed earlier in the presentation, that diabetes is 3 times more likely to occur in Aboriginal and Torres Strait Islanders people. It is also associated with an array of complications. If the diabetic remain untreated, it can lead complications like a diabetes-related foot disease. The rate of diabetes-related lower limb amputation due to foot disease is remarkably higher in Aboriginal and Torres Strait Islanders, especially in rural and remote areas, which is also mentioned in SARA 2016. Thus, it is important to create awareness in community by conducting diabetes awareness program, which involves community members and elders. For example, Services for the Australian Rural and Remote Allied Health, SARA, developed the NSW Aboriginal Diabetic Food Program to encourage people about food care. The use of local language, media, and artwork was emphasized in this program. Additionally, through the program, it was significant that the language to be used for food care message was created using local culture knowledge and was discussed with the Aboriginal elders. Now, moving towards the health resources available in relation to for Aboriginal health are not defining and efficient. There is need to have resources. Here, we will formulate some different ways in which resources can be strengthened with respect to cultural competencies. The first step can be recruiting more local Aboriginal health workforce through the involvement of community members in a healthcare and workforce. Culturally safe healthcare can be provided to Aboriginal Australians, which is also focused on the SARA 2016. It must be noted that Aboriginal health workforce can be effective in educating non-Indigenous staff by making them culturally competent. Thus, it results in providing cultural safe healthcare delivery. Furthermore, elders and Aboriginal health workforce should be considered as a greatest resources while providing health services. Alternatively, If an Aboriginal elder is not available in the community, we can still consult highest respected person in the community to create equitable, appropriate program or services. Now let's just discuss about nursing responsibilities. Nurse and midwifery profession plays a significant role to improve the health of Aboriginal and Torres Strait Islanders people to reduce health inequity. According to Nursing and Midwifery Board of Australia, NMBA, and Professional Code of Conduct 2008, principal responsibilities of nurses is to respect culture, ethnicity, belief of patient. For example, nurses can show respect by avoiding direct contact, eye contact, without being judgmental, and using gesture as a means to communicate with the Aboriginal patient. Nursing standard of practice must comply with the therapeutic relationship and patient safety. Nurses should engage themselves in a continuous professional development to provide cultural sensitive care. This can be carried out by undertaking a specialist diabetes training, which incorporate Aboriginal and Torres Strait Islanders learning cultural, safe, and holistic approach to care of Aboriginal people with diabetes. Furthermore, awareness building regarding mental health and how it affects diabetic patients to control the blood sugar plays significant role to enhance it. In addition to this, a specific nursing care should involve screening and early detection of type 2 diabetes, promoting self-care, regular blood glucose monitoring, periodic urine check, and oral therapies. Now, it is clear that diabetes mellitus is significant health issues for Aboriginal and Torres Strait Islanders, specifically residing in remote areas. The lack of education and access to health services further worsen the prevalence and consequences of diabetes. There is need to appoint Aboriginal community members in Aboriginal health workforce and introduction of diabetic program. It can help in promoting Aboriginal health at cultural safe level. Also, nurses plays critical role in providing cultural competent healthcare. Nurses involve themselves in therapeutic relations with the patient to provide relevant information about diabetes. And a cultural competent nurse is able to promote health and can increase positive health outcome amongst Aboriginal and Torres Strait Islanders. We have taken all of these materials from our reference point, Apunima Cape York Healthcare Councils, 2016, Good Food for Good Sugar, Australian Bureau of Statistics, the Health and Welfare of Australian Aboriginal Health and Torres Strait Islanders People, number 47040, Department of Prime Ministers and Cabinet 2016, Closing the Gap Prime Minister Report 2016, Diabetes Australia 2015. Also, we are very, very thankful to our lecturer David, who has supported enough to make this PowerPoint presentation and made available all the resources and necessary information. Also, we are thankful to the Western Sydney University, so that it has given us opportunity to promote ourselves as well as lead us into the continuous professional development sector in the nursing and midwifery, and all the resources which were made available from the Western Sydney Uni. Thank you for listening. If you have any questions, email us Email is 18750762 at student.westernsydney.edu.au. And if you wanted to call on a mobile, that would be 040-1525-063. Thank you all. Thank you for listening, and thank you for the PowerPoint presentation. Thank you.